All right. Hello and good evening, everyone. We are right at 6 o'clock. I'm sure we will have several folks who join us as we get started here, but my name is Mary Alex Kopp. I am the Vice President and Chief Public Relations Officer at ABLE, South Carolina, and I'm going to get us started right away because we have a lot to cover today. But thank you so much for joining us. We appreciate having you here. On screen, we have a visual graphic that says 35 years of the ADA, State of Disability Pride SC, and it has an illustration of people with a variety of disabilities in the bottom left corner. You'll see that illustration across our slides. Before we get started, a couple of notes on Zoom rules and how to ask questions for this evening. Your microphone will be muted until the end of the presentation. After the presentation, we'll be happy to answer your questions. You can use the Q&A feature to send your questions throughout the presentation. You can also ask to be unmuted to ask your question directly to the presenters after the presentation is finished. It is a great idea to write your questions down as you think of them. If you'd like to do this, I encourage you to go ahead and get something to write on now before we get started. Okay, so as we're preparing to go into our presentation, I do have some really exciting news to share with our disability community, and that is that both the City of Greenville and the City of Columbia have honored our community with proclamations celebrating disability pride and the ADA anniversary. We've got a couple of representatives with us here this evening who are going to talk about that, but before we do, my tech head, Alyssa Hamrick, has her hand raised to remind me I forgot to say some important things about ASL interpretation and captioning. So Alyssa, if you can come off mute and remind everyone about that real quick.
Of course, I would be remiss if I didn't also add that for those who need it, we have ASL interpretation. Feel free to pin the interpreter on your screen. And then we have live closed captioning. If you do not see it already on your screen, you can press the CC button at the bottom of your screen. For those who really like, we also have an external live captioning window that allows you to see the full transcript as it's going. I'm going to post that right now. Back to you, Mary Alex.
Awesome. Thank you for that. And if anyone has any issues related to tech during this Zoom webinar, feel free to reach out to Alyssa using the chat. And we also have another member of our staff, Renata, who can answer your questions. Awesome. So without further ado, I am going to quickly pass the mic over to Vice Mayor Pro Tem Dorothy Dow with the City of Greenville, just to tell us about the city's choice to do a proclamation celebrating Disability Pride Month and the 35th anniversary of the ADA for the City of Greenville.
Well, thank you, Mary, and good evening, everyone. It's great to see everybody via Zoom. I speak to you from Prisma Hospital in the parking lot. And Councilwoman Bustles, I'm not sure we've ever met, but it's good to see you, my colleague in Columbia. It's really an honor to be with you guys tonight. We're honored to be asked, and so honored to give the proclamation, which I won't read tonight, but I just want to acknowledge the expertise and the voice of ABLE SC. We rely on y'all so much to represent those with disabilities as we govern. Here in Greenville, we're growing a lot, and it's our goal to always be growing inclusively, and we rely on ABLE SC's partnership to help us with that. And I think, wow, I cannot believe it's been 35 years since the ADA came into being. I was a young engineer practicing in pulp and paper industry at the time, thinking, wow, this is a really big deal. And sure enough, it was. And look at how just what a game changer it's been in such important legislation. So it's great to see everybody here tonight. Keep up the great work that you're doing. Please keep your voice constantly in our face as elected officials. And we just wish you all the best and really appreciate your partnership.
Thank you so much, Dorothy. We sincerely appreciate you being here tonight to honor our community. Now I'll pass it over to Councilwoman Bustles from City of Columbia, who have also proclaimed Disability Pride Month and the 35th anniversary for the City of Columbia.
Well, thank you all so much for being here tonight. And I am also in the car headed to a neighborhood meeting, but it is a pleasure to be with you all. I'm Aditi Bustles. I'm your at-large councilwoman here in the city of Columbia, and it is my honor to be with you to present a proclamation recognizing Able South Carolina for their unwavering leadership in advancing disability rights, equity, and inclusion. We deeply appreciate, especially in a time like this, the tireless advocacy of our local organizations, because I truly believe that local government is where we can make the most meaningful change. And I hope that we continue to work together to move our city forward towards a future where every resident, regardless of ability, can live, work, and thrive with dignity. As some of you all know, my other hat when I'm not councilwoman is I'm a public health researcher. So I always think about things from the lens of equity. And I know that real equity, especially in the disability community, means removing those systemic barriers and centering voices of those that are most impacted. And I'm just really grateful to ABLE-SC for how much they've done to push that forward, and look forward to partnering with them on other initiatives to help raise the awareness and honestly celebrate, right, all of the diversity that we have within our community. So thank you all for having me. Congratulations on such a special moment, and look forward to working alongside you.
Awesome. Thank you both so much. And again, thank you to the City of Greenville and the City of Columbia for this really awesome honor. We've got a couple of little claps showing up from some reactions from our audience. So thank you. Thank you. We really appreciate you being here. Y'all are more than welcome to hang out in the background, listen to the presentation. But I am going to move from our screen where we're showing the proclamations, which somebody asked in the chat. We are going to send these out to you guys after tomorrow, following this meeting, so that you guys can see these proclamations right in your email. But for now, we're going to go ahead and move right on into the meat of why it is that we are here today, why it is that we are having this town hall. So I'm excited to introduce my colleagues, Larry, Kimberly, and Allie. I'm going to let you guys introduce yourselves here and go on mute myself. But as a reminder to those who are attending, if you have any issues throughout the presentation, feel free to use the chat, and you can use the Q&A feature to ask questions. We will attempt to answer all the questions we can at the end of the presentation. So I'll kick it off to you guys.
All right, I think I'm first. Good evening, everyone. I'm Larry Wenger, and I am with ABLE-SC, as Mary said, and I'm the vice president and one of the vice presidents, and provides support to the advocacy and independent living team here at ABLE-SC. So it's great to be with you today.
Hey everyone, I'm Kimberly Tiso. I'm the president and CEO of Able South Carolina. I'm just going to do a visual just for accessibility. I am a white middle-aged woman with light brown hair that goes to my shoulders, and I'm wearing glasses and a blue and white shirt today. If I was presenting in front of you all, you would see that I am a person with one leg and I walk on crutches. So I'm a proud disabled woman tonight, and so excited to spend some time with you all.
Hi, everyone. My name is Allie Springate, and I'm the Director of Advocacy here at Able South Carolina. Also for accessibility, I'm going to give a physical description of myself. I'm a white woman with long brown hair and bangs, and I wear glasses. And today I am in my office, and I'm wearing a short sleeve, dark green top.
Right. Guys, I'm sorry to interrupt, but I forgot something very important that we had discussed in our pre-meeting for this, which is to let everyone know we had planned for this meeting to go just to 7 o'clock, but we understand that this content is going to be a lot of information. So it's very likely that we will run past 7. And we will try to get you guys out of here by 7:30 at the latest. So just bear with us. We also are recording, and we'll be happy to send you a recording of the full webinar tomorrow so that you can review anything if you do have to sign off early for any reason. All right, I'm going to go back to mute.
Okay, really briefly, before I go into a little bit about disability advocacy, Able South Carolina is a center for independent living, and we focus on 5 core services. We're a nonprofit organization And so part of our services is that we do a lot of disability rights advocacy, and we're disability led. As Kimberly said, she's a disabled woman. Over 80% of our staff have some kind of a disability. So this isn't just important to us because it's good work. We literally live this. I myself am disabled as well and have a psychiatric disability, and I'm very proud of that. So Mary Alex, if you'll go on to the next slide, we'll go ahead and talk about what disability advocacy is and why we do what we do.
Allie, we're actually going to kick it to Kimberly real quick.
Real quick, so sorry.
Oh,
So,
no,
hey everyone, I just wanted to welcome everyone and just talk about a little bit about tonight and what we're doing. So we're here tonight for what we're calling a State of Disability in South Carolina. And so this is going to be a new quarterly series we're launching because really we're in a moment unlike any other that we've ever seen before. Policies and programs and protections that impact disabled people are shifting very, very quickly at both the state and national level. So it's important. It's very, very important for us to be here and be on the same page as everyone. We need to stay informed, prepared, and we need to be unified in our responses. So we'll be holding these briefings every quarter to provide clear factual updates to change the effect of change the effect of disabled South Carolinians, but also from Medicaid to civil rights protections to long-term services. We're going to talk about it all. Anything that comes up within a quarter, we're going to bring it to you all and explain what it means and how we can advocate either against it or for it. And so please note that this is not a political webinar whatsoever. ABLE South Carolina is a nonpartisan organization. And our goal today is simply to review the facts and help people understand how current events and decisions may impact the disability community. So we appreciate you being here and we hope these briefings become helpful resource. And now I'm going to pass it to Allie because she's really excited to talk about advocacy.
Yes, I am. Okay, so what is disability advocacy? Essentially, it is taking action to create equal rights, access, and opportunity for all people with disabilities. Policies and laws that impact disability should be influenced by people with disabilities. And just as a reminder, a policy is a clear rule or a plan that tells people what to do in certain situations. So a policy is like a guide for making decisions and taking actions. So our advocacy says no to ableism in systems. Systems include healthcare, education, employment, housing, voting, etc. Literally the full spectrum of the human life. Disability is a part of it. An important thing to note, Kimberly already mentioned this, but I really want to emphasize this. Our advocacy is strictly nonpartisan, which means that ABLE South Carolina does not take sides with any political group. So this event included is nonpartisan. Everything that we do is nonpartisan. We advocate for change that benefits all disabled people, not particular political candidates or groups, because disabled people are all across the spectrum of all political sides and aisles. So it's important that we call out leaders when policies harm disabled people. And first and foremost, that's the most important thing. Next slide, please. So why do we advocate? Again, policy and laws affect every part of your life, from healthcare to school to housing to your income. Disabled people are often left out of these decisions that directly affect us, and that needs to change. And we're doing a lot of work to make that change. We advocate so that nothing about us happens without us. You'll probably hear that phrase a lot in disability advocacy. Next slide, please. And I believe that yes, we're going to go over what we're going to talk about. So today we're going to talk about what's going on in our national government. We're going to talk about some changes to Medicaid, changes to SNAP. We're going to go over disability rights content, focusing on updates to Section 504 and the Americans with Disabilities Act, updates on a new executive order called Ending Crime and Disorder on America's Streets. We're going to talk about what's going on in our state government, new policies, specifically on a bill that was passed to make changes to departments of mental health, disabilities and special needs, and substance abuse. And then finally, we're going to end our talk with practical ways that you can participate in advocacy, as well as answer some of your questions. Okay, and then I'll turn it over to Larry to talk about Medicaid.
All right. Thanks, everybody. And I'll apologize at the outset. My neighbor has chosen this very time to mow their grass. And so there's some background noise that I hope you can't hear. That's always the way it goes. Thanks for being here. And I'm going to spend some time talking with you about Medicaid. And I know that there's been a lot of conversation about Medicaid, and it's very concerning for folks. What's happening and trying to understand it can be challenging. So we're going to attempt to go through some of the issues tonight and talk through that. And hopefully you leave with a better understanding of what's happening with Medicaid and how does it affect you. So we're going to start with Medicaid basics on the next slide here. And first of all, it's important to understand what Medicaid is, right? It's a insurance program that's provided to pregnant women, people with disabilities, folks with lower income, and older adults. And it's important to know that in South Carolina, when we talk about Medicaid, it's called Healthy Connections. So your card, if you're in South Carolina and wondering, your card does not necessarily say Medicaid, but it's going to say Healthy Connections. And that's how you know. So we want to talk about Medicaid expansion because for years we've been hearing about that. So really, in brief, Medicaid expansion was a way that was developed through the Affordable Care Act and has continued for a number of years that changed the rules that allowed folks who might not usually get Medicaid to be able to qualify for Medicaid. So more adults with low income, even if they didn't have a disability, for example. And non-expansion are states. So to back up, there was the option for states to decide to become expansion states, and then the option for other states. States might have chosen not to take advantage of the program and expand eligibility for Medicaid. And so there are 10 states, including South Carolina, Florida, Texas, and others, that have not expanded eligibility for Medicaid. And so they're called non-expansion states versus the other 40 states that did and provided a pathway for more people to take advantage of Medicaid. They're called expansion states. And it's an important distinction to understand because as we go through this next couple of slides, you'll hear me talk about this is happening in expansion states and not happening in non-expansion states. And so the bottom line from that is to understand that South Carolina is not an expansion state. So Medicaid in South Carolina is still limited to low-income children, pregnant people, seniors, and people with disabilities. Many adults who don't have children, for example, cannot get Medicaid, even if their income is really low. So we're going to go to the next slide and talk a little bit about Medicaid waivers. And this is important to understand what this is as well. So it's more definition. Essentially, a waiver is permission or approval from the federal government that lets a state change or offer new services to people that may not be typically part of what we think of as traditional Medicaid. So different or extra services, think of that. Waivers were created, and we think, waivers were created to keep people in the community, and we think of that or hear the term home and community-based services or HCBS, and these are waivers. So programs that help folks have the support they need to live in the community. It might be personal assistance services, things like that, where folks can get those supports that enable them to live in the community instead of ending up in a nursing home or other institutional setting. Right now in South Carolina, it's important to know that there are roughly 41,000 people on the wait list hoping to receive and waiting to receive waiver services from the various waiver programs that we have here. We're going to move on and talk about Medicaid funding. So we kind of, sorry, there's a little bit of redundancy here in the slides, but basically that states have the option to choose if they're going to offer home and community-based services or waivers. Those are optional programs, and there's an important distinction to understand there, that they're optional versus nursing homes and government paying for nursing home care. That's mandated as part of Medicaid. So it's an important distinction to understand, again, that waiver services such as home and community-based services are optional for states to offer. Whereas we talk about the bias, institutional bias in the Medicaid system, that the payment for folks to stay in nursing homes and other institutional settings are mandated, that Medicaid must pay for these things. So we'll come back to that piece of the conversation in a minute. We're going to move on to the budget reconciliation bill that just passed in Congress and was signed by the president, and what those changes mean, or what changes are happening. So it's important to know that expansion states have some changes in the bill that affect them differently than non-expansion states. So expansion states, for example, under the bill would get less money to run their Medicaid programs. Also in expansion states, work requirements will be in effect. And this is new, but that some adults, you've heard about this every 6 months, that Medicaid recipients will have to refile for benefits and prove they're eligible. And this is in expansion states and only applies to certain people, right, who have to meet the work requirements. But it's not applicable in South Carolina because we're not an expansion state. Folks in expansion states who are just above the poverty level may also find themselves paying more out-of-pocket costs, co-pays, premiums, and those kinds of things. And we already just mentioned the changes to paperwork requirements and eligibility checks for people, for beneficiaries in expansion states. So let's kind of bring this all together and move on to the next slide and talk about what Medicaid cuts will mean for providers, so hospitals, medical facilities, and that sort of thing. Starting in 2028, there's a program called the State Directed Payment Program, which allows hospitals to receive reimbursements closer to private rates under Medicaid. That's going to go away. And so there's going to be an impact financially on the bottom line of hospitals. And you've probably heard things in the news about the possibility that rural hospitals may have to close. We expect that hospitals in South Carolina would lose about $150 million a year, which is very significant to their bottom line. The total financial losses will be in the billions. And so 2.4 billion is the estimate, and that loss of revenue will significantly impact services. So we'll continue with the next slide. These cuts will make it difficult for hospitals to remain financially stable, especially in rural communities where more folks tend to use Medicaid benefits. Will result in increased prices for folks who have private insurance, maybe through their employer. This is called cost shifting. So everyone will see on private insurance will likely see higher costs. Services may be cut, especially services that are losing money. Not every medical service provided by a hospital generates revenue or enough revenue to cover its costs. And so those services where they lose money will likely be the first to see cuts or elimination. Laying off staff, and in the worst cases, closing the hospital entirely. So there's a real significant impact on hospitals, which really affects all of us, not just Medicaid recipients. There's also likely an impact on outpatient and preventative care for folks who use Medicaid, people with disabilities who use Medicaid as well. Those services may be reduced, or they may be lose access to those services. Doctors and hospitals may also become less willing to accept Medicaid patients because of these cuts. And then finally, I mentioned earlier home and community-based services and that they're optional. So one of the things that's important to understand, again, as I talked about optional, waiver services, HCBS versus mandated payments for nursing home care. So if states like South Carolina start to see a financial impact, which we expect, and less money to provide services, what will likely happen in states is that HCBS and other waiver services will likely be eliminated or significantly reduced because they're not mandated. They're optional services. And this is so harmful to our community as we think about the likelihood then that there'll be an increase in the number of folks facing nursing homes or institutionalization. So it's a very real threat to our community. We'll move on to the next slide. We want to talk about what Medicaid, what will Medicaid cuts mean for folks who are on ACA plans? That's Affordable Care Act. The folks are able to buy coverage, as you know, on the marketplace as part of the Affordable Care Act, and there'll be an impact on that program as well. So they're private health insurance plans, right? Not necessarily not Medicaid. They're private plans people can purchase. There's approximately 200,000 people in South Carolina who rely on these plans currently. I'm sorry, 300,000 people rely on these private ACA plans currently. As we talked about, when providers like hospitals have to charge more for services, it means higher costs for everyone, including folks on ACA plans. Costs of services then, as we talked about, will rise significantly, especially in rural communities. Premiums will rise significantly as well. We know that. We're already starting to hear about that. And so it's important to understand that there were subsidies that helped to cover premiums for folks. Those were set to expire this year, and they were not renewed and have not been renewed. And so that's the impact, the higher premiums and higher costs for folks on these ACA plans. That's the end result, is that without these subsidies, the costs are significantly higher. I'm going to talk next on the next slide about a program in South Carolina that's important to talk briefly about, that's Medicaid related. It's called Palmetto Pathways, Palmetto Pathways to Independence. This is a Medicaid program that will potentially provide coverage for folks who otherwise might not be eligible for Medicaid, specifically low-income folks who don't qualify for or who can't get ACA plans. They can't afford the plans. And right now, this program is not quite in operation. A request has been submitted to the Centers on Medicaid, CMS, for the program to be approved. And that just went in, I believe, last month or very recently, and we're waiting to hear back if it's going to be approved and operational. There's some, I don't want to get too far into the weeds about who would qualify for this program. You see some bullet points here. I'll try to review them quickly. Working parents between the ages of 19 and 64, parents who meet certain requirements, standard Medicaid requirements, parent caretaker relative requirements. You see incomes between certain levels related to poverty. And then participants will have to complete community engagement or work activities. And it's 80 hours a month. Job training, community service, work, volunteering, etc. So we want to talk next, moving along quickly, and I'm taking a lot of time here, around work requirements from a disability perspective. So you've heard about work requirements in expansion states, and then also potentially work requirements under this Palmetto Pathways program. From a disability perspective, though, they create barriers to healthcare. People with disabilities are often excluded from the workforce already. So to tell folks, in order to get Medicaid, you're going to have to work, it creates real challenges, and folks will struggle with that. And then documenting exemptions is really difficult, or can be really difficult. And we've seen before in other states, work requirements were proposed but weren't effective. I think it's important to highlight, just because we talked about in expansion states, mainly folks with disabilities who are on traditional Medicaid might be excluded somewhat. The reality is that there will be folks with disabilities who are getting Medicaid because of expansion. They're working and relying on Medicaid as their provider in expansion states. And the reality is that folks with disabilities will be affected. And this is really key, because we keep hearing folks with disabilities are safe. They're not going to be impacted by these changes. But between what I just talked about in expansion states, folks with disabilities are relying on Medicaid expansion and working. We've got folks who are disabled receiving Affordable Care Act, ACA health plans, who will be affected, right? So folks with disabilities across the board there. And then we talk about waiver services and home and community-based services versus the mandated nursing home payments and institutional payments. Again, folks with disabilities will absolutely be effective. So this is a very harmful package of things that have been passed into law that our community is facing. On the next slide, there's a timeline for changes. So this is unfortunately not super accessible for me to read, but we're going to be sending it out, and you can see it here on the screen. If someone wants to jump in and visually describe it, that might be
Larry,
fantastic.
it's Mary Alex. I will jump in really quickly and just read out what is on the screen. And as Larry mentioned, this will be sent after the fact. Apologies, Larry, for the accessibility issue with that timeline. But we have here, it says timeline for changes to healthcare in the USA. Under the point to the far left, it says today, SC Pathways to Independence program is waiting on approval from CMS. The next point is August 25th of this year. Access to ACA marketplace plans ends for DACA recipients. And a reminder that a DACA recipient, that's a deferred action for childhood arrivals, who are children who came to the United States and grew up here and are now adults. January of 2026, ACA marketplace plan costs will go up dramatically based on the information we have shared with you this evening. October of 2026 to January of 2027, immigrants will have a limited or removed access to ACA marketplace plans and Medicaid. And we want to be clear, when we use the term immigrants, we are talking about people who have immigrated to the United States who are under a variety of immigration statuses. January of 2027, nationally, work requirements and eligibility reviews every 6 months will begin for expansion states. In January in South Carolina in 2027, your third month of retroactive coverage will be taken away, and now you will only get 2 months before your application. Also, South Carolina will begin to phase out that state-directed payment program, causing hospitals to lose money and Medicaid funding. In October of 2027, new out-of-pocket costs begin for adults in expansion states, and new verification requirements for ACA marketplace plans start. In January of 2028, ACA marketplace plan auto re-enrollment and provisional enrollment ends. This could kick people off of their insurance without their knowledge. That is what that means. Larry, I'm going to pass it back to you.
All right. That is actually the end of my portion of the presentation. Obviously, if folks may have questions, please use the Q&A thing to drop your questions in, and we'll hopefully be able to answer those later. Thanks so much. And I think we're going to Allie.
Yes. Okay, this is Allie, and I'm going to talk about some changes to SNAP, and I'm going to be real snappy with it for the sake of time. So if for any reason you have questions or want to know more information about a specific part, please feel free to use the chat feature, the Q&A, or you can follow up with us afterward, and we'll give you that information as well. So what is SNAP? SNAP stands for the Supplemental Nutrition Assistance Program. Essentially, it used to be called food stamps, and its whole purpose is to help people with low income buy food. Each month, people who qualify get money on a card, like a debit card, that they can use at the grocery store to buy food, and it's a government program to help make sure families can afford enough to eat. Let's go on to the next slide. So here on this slide is a table that shows some changes to SNAP. And so I will go over the categories and then the old SNAP requirements, so requirements that were in the past, and then new updated SNAP requirements after the passing of the budget reconciliation bill. So for age groups, this first category is age groups required to participate in work requirements. The old SNAP rules had 18 to 54-year-olds participating. That age range has extended from 54 to 64. So now 18-year-olds to 64-year-olds will participate in the work requirements. The hours for that used to be 20 hours a week up to 80 hours a month. Or around 80 hours a month, and that is still the same. The activities allowed included volunteering, job training, actual employment activities, or community services. That will also be the same. And then specifically for veterans, homeless individuals, and former foster care youth, they did not have to follow those SNAP work requirement rules. They used to be what the term is exempted from that. Now, starting in 2030, so what year are we? 2025, 5 years from now, they will have to start following those work requirement rules. For parents and caregivers, they did not have to follow the work requirement rules if they were caring for a child under 18. Now, you only do not have to follow those work requirement rules if caring for a child under 14. So the age has changed from caring for a child under the age of 18 to now caring for a child under the age of 14. Those are the people who do not have to adhere to the work requirements. If someone is caring for a child over the age of 14, they will have to follow work requirement rules. As far as how often people have to resubmit applications for renewal, for eligibility renewal, the same rule applies. It used to be every 12 months, and it is still every 12 months. And just as a refresher, people with disabilities who qualify under the Social Security Administration's definition of disability, which mostly depends on medical documentation for that. If you have any questions about that in particular, please feel free to follow up with us. People with disabilities are excluded from the work requirements. That's important to mention here. Also, people who are exempted or who do not have to follow work requirements are people who are caring for a person with a disability, members of federally recognized tribes, folks who are in school at least half-time, folks who are getting unemployment benefits, people who are already working 30 plus hours a week, or folks in a substance use or rehabilitation program. Okay, next slide. So here's some more changes to SNAP. And this slide gets a little bit involved. So I'm going to try to explain it as best I can. For the first time in SNAP history, states, including South Carolina, our state, must help pay for actual food benefits starting in 2027. And this has a lot to do with what is called the error rate. So the SNAP error rate is a percentage of payments paid incorrectly, either too much or too little when people receive food benefits. And what's important here is that most of these incorrect payments are not fraud. They're actually administrative errors like paperwork issues or mistakes made by human beings just doing their job. So from October 1st, 2027, states that have an error rate, remember that percentage of payments that are incorrect, if their error rate is 10% or more, then they have to start paying for 15% of those food benefits themselves. In a nutshell, it just means that states are going to have to look at paying a lot of money if they make a lot of errors. Some states may choose to cut benefits or make more rules that make it harder for people to qualify for SNAP. So really narrowing that eligibility requirement so that fewer people will end up being able to be on SNAP. So it's important to be aware of that here. Essentially, South Carolina would then need to find hundreds of millions of dollars to pay its share of SNAP. And just for context, it's worth noting in 2023, South Carolina had a 22.57% error rate. And remember that cap is 10%. So we had among the highest in the US. But in 2024, we only had an error rate, it improved to 9.5%. So it can fluctuate, it can change from year to year, but we're still very much a state that's definitely at risk of getting over that 10% error rate. So when states are forced to consider paying that amount of money, they could choose to cut these services so that they don't have to worry about paying that amount of money. So that's the risk there. Another thing I want to mention is that money, that amount of money that states may choose to not pay and decide to cut, it could come at the expense of education, of healthcare, disability services, risk of cuts to benefits. So if South Carolina doesn't raise enough revenue or enough money, it may lower those monthly SNAP benefits. It can restrict eligibility and add those barriers, administrative barriers, to reduce the amount of people that can enroll in SNAP. So in a nutshell, this could really impact how South Carolina residents can receive SNAP benefits, if they'll receive SNAP benefits. So something to be aware of as we continue. Okay, let's go to the last slide here on SNAP. So again, just to reiterate, before the federal government paid 100% of the cost of the actual SNAP benefits, so the money that people use to buy food. So states like ours only helped pay for the administrative costs, running the program, staffing it, processing applications. Now, this would change SNAP from a program funded entirely by the federal government to a program whose costs are shared by states and the federal government, very similar to how Medicaid operates. And this change could make the program much less stable, especially in poorer states, more rural states too, like South Carolina, that already struggle to fund the services that we do have. Okay, so now we're going to go on to Kimberly, who's going to talk about Section 504.
All right. Hey, everyone. I'm going to go into Section 504. Probably many of you have heard about this lawsuit. It's called Texas versus Kennedy. And right now, South Carolina Attorney General is on the lawsuit. It's one out of 17 attorney generals who are still pursuing this lawsuit. So we do want to talk to you about where we are with this. Next slide. So first, what is Section 504? A lot of people associate Section 504 just with school accommodations. That is it, but it also includes a lot more protections. So pretty much any federal agency and any agency receiving any type of federal funding must have these anti-discrimination policies and must be accessible for people with disabilities in all areas. So when you think about federal agencies, you can think of Department of Education. Department of Education in the federal area is a federal agency, but they also give a lot of money to South Carolina's Department of Education. So because South Carolina receives federal funding, they have to also follow Section 504 of the Rehabilitation Act. So the programs include, we talked about public schools, but it includes hospitals and clinics, any government programs, any state government programs, public transportation, housing and job training, accommodations within colleges, and the list really goes on. But why should we all care about it? So this is Section 504 is it's the first disability rights protections that we had. It passed in 1973, so we are over 50 years of having protections under 504. If you have a disability, Section 504 says that you must have equal access and you must be treated fairly like non-disabled people are. So places of reasonable accommodations should include you. If you ever have accommodations and are not providing that, that could be a complaint. But information must be fully accessible. Buildings must be accessible, and you should really have no access issues. I know that is not always the case, but we still have a lot of work to do around disability rights. So again, who is protected? It's anybody with a physical or mental disability that significantly impacts one or more major life activities. So like walking, seeing, hearing, learning, caring for yourself, and the list goes on and on. So that is the same definition as disability under the Americans with Disabilities Act. Remember, to be a person with a disability, you do not have to receive Social Security. Social Security disability has a different assessment that they use to deem somebody disabled, and that is only disability for folks who may have more issues with working. So that, of course, there's two separate definitions, but just because you are not on Social Security does not mean you have a disability. So I'm not on Social Security, and I have a disability still protected under 504 and the Americans with Disabilities Act. Next slide. So let's talk about Texas versus Kennedy. So this is a federal lawsuit right now, and it's somewhat on hold, but it was a lawsuit that was filed in September of 2024. And it was filed against the Department of Health and Human Services because of the new final rule around Section 504 with only Health and Human Services programs. So the lawsuit, yes, used to be called Texas versus Xavier Becerra. I can never say that, but Texas was actually suing the Secretary of Health and Human Services in the very beginning because of the protections that were put in place under HHS in late 2024. And I'll explain those in a minute. But it did change to Texas versus Kennedy because we have a new secretary, and now that is part of HHS, and the lawsuit has to go to them. So what is the lawsuit trying to do? And this is really a scary point. The lawsuit challenges the 2024 updates to Section 504 of the Rehabilitation Act. So it asks courts to get rid of updated sections of 2024. Now the sections are really important that did get updated because remember, the Section 504 was passed over 50 years ago. Lots of things have changed. So really what it really did is just really update and came into the times. But what the new sections included was the support, the right of people with disabilities to live in the most integrated settings appropriate and help hold the federal government accountable. So who doesn't want that? Why would anybody be pushing back against living in the community? It's improving requirements for accessible medical equipment, effective communication, and equal access. And so I used to always tell the story when I used to go to the doctor, I could never find out how much I weighed because the scales were not accessible. But now under this final rule of Section 504, healthcare facilities have to be accessible. Another example of that is mammogram machines. For many years, people with disabilities who were wheelchair users or short stature, they could not get a mammogram for preventative care because the machine did not go down low enough. Just simple things. But with the amendments to Section 504 with HHS programs, they would have to change to be more accessible. It also includes clarification about accessible digital tools and website kiosks. I know we all see those kiosks now going into any type of doctor facility or even hospitals, but a lot of times those aren't accessible. So what does that mean? People with disabilities who may not be able to read, would not be able or not be able to see, would not have access to these kiosks. And so that would have to enable somebody to come and help them, which also could put out their private information out loudly in these waiting rooms. It also includes protections for child welfare, education, and decision makings in healthcare. So just going back to child welfare, it would ensure that people with disabilities would not have their children removed on the basis of their disability. It would allow people with disabilities to foster and adopt. These are all rules that we fixed here in South Carolina in 2017, but these are laws that should be, this is a law that should be protected all throughout the United States. There should be no discrimination on the basis of disability, and especially over 50 years after Section 504 passed. Next slide. So what happens next to the Section 504 lawsuit? So right now, it is on hold, but what will happen is real world protections for people with disabilities could be weakened. And so really healthcare, when we need healthcare to be accessible, but it will impact our equal access, accessible equipment, protections and treatment decisions, education and child welfare, like I mentioned before, community living, protections from unnecessary institutionalization. South Carolina currently has a lawsuit from the Department of Justice that we were unnecessarily institutionalizing people with disabilities. And so we need to continue to have these rights to ensure that we have access. Next slide. And now I'm going to talk a little bit about something new that just recently happened. There was an executive order, and it was called Ending Crime and Disorders on American Streets. And so I just want to make sure that you all know that Able South Carolina did put out a position statement. We are very against this because it would be detrimental to the disability community as it would threaten our civil rights. So what does this mean? We'll go to the next slide. So what is this? So it encourages states to put people with mental illnesses and psychiatric disabilities into institutions. So no matter what their housing status is, which is very scary. So that could be anybody. You could be going through a very difficult time and, looking at grieving, you could be experiencing an episode of a psychiatric disability and you could easily be put in the institution. Now, deinstitutionalization happened way in the 70s. We've already looked at institutions. They did not work. They abused our people. They prevented our people from being independent. So this does not work, and it's proven that it does not work. So this executive order wants to bring all that back. It would also allow states to share the private health information of these populations with the federal government. What would they do with this? I have no idea, but this is private information. Just because someone has a disability does not mean that their private information should be shared with anyone. And it would also allow the federal government to put more money into institutions instead of home and community-based services. And so Larry talked about, we have 44,000 people in South Carolina that are waiting for home and community-based services right now. But the federal government is not kind of overlooking people on those waiting lists and on those waivers because they're going to start putting funding into institutions, which is very scary. Because our folks do not belong in institutions. They belong in the community with supports, and that is what we should be investing in. There is a huge return of investment on home and community-based services that is being overlooked. And I will tell you, all of these executive orders that have come out about disability, there has been no disability consultation with any federal disability organization, any national, any state groups. So that is a concern because who knows disability more? It is the disability organizations and people with disabilities. So why is this an issue? This would be a huge step backwards. And we've made so much progress over the years, and it would increase that we made so much progress to increase home and community-based services. We fought for that hard, the disability community did, and we won that. This started really in the 70s again because we were seeing that people with disabilities were being abused and neglected in institutions, and we shut them down. And we shut them down for a reason. Institutions are extremely harmful and non-effective. And so research has shown that community-based living leads to better results for people with disabilities, period. So you might ask yourself, why in the world are we going backwards? We have the same question. Next slide. And so I'm going to talk a little bit about some threats right now to our disability rights. But I also want to share some cases and kind of what has already been done with you all, what has been done with federal law. So right now, I'm going to talk a little bit about a 504 case that actually had a very positive ruling in the Supreme Court. It was a school accommodation request under 504 that the school did. It was founded that the school did discriminate against the student, and they won the case. But there is something that within the ruling, there is something that was put out in the ruling that is very scary, that I think every disability organization in the United States really found. But in the documents, and we'll put that into the chat in a second. But Supreme Court Justice Thomas and Kavanaugh hinted that in the future they might want to change and say that disabled people must always prove intent, even just to get basic help, like being allowed back in school or getting accommodations. So, what would this mean? This would be significantly weakening and putting the burden on people with disabilities to show that disability discrimination happened, but also that there was an intent to it of happening, which is very dangerous. It's watering the Section 504 down, but it would be proving intent is extremely hard. So proving intent to any type of discrimination is extremely hard. But most discrimination isn't openly hateful. It's buried really deep in bad policies, biased decisions, and inaccessible systems. And if intent is required, think about this. Disabled students, workers, and others could lose access to justice because they wouldn't be able to meet the higher legal bar. And it would weaken civil rights protections as a whole, especially for kids and adults who are already facing discrimination but can't prove someone meant to do it. There's been a lot of discrimination that has occurred, and we've never been able to really point to it because of the deep policies. It's also a lot of times discrimination happens because people just don't know about Section 504 or the Americans with Disabilities Act. So also in March and April of 2025, the Department of Justice also rescinded 11 non-binding guidance documents designed to help businesses and institutions comply with the ADA. So I want to tell you all that 11 pieces of guidance to implement the ADA and to enforce the ADA was rescinded. And a lot of these sections were really were around COVID-19, long COVID, but it also applies to outdoor restaurants. It applies to making medical facilities fully accessible, having patients' rights. And I know this was something that we're always advocating for, but having that family or assistance with you when you're in the hospital. That really came up as an issue during COVID, and that has since been rescinded. But it also expanded, it took accessible customer service away from hotels and lodging for guests with disabilities. I mean, it is really, it's going to be a deep impact for all of us. But what we don't want to see is the disability rights throughout the country weakening anymore. So on this chart, you'll see that Section 504 of the Rehabilitation Act, what does it do? It stops discrimination against disability in any programs or activities that gets federal funding. And so our current threats of it is this lawsuit, Texas versus Kennedy. And then funding cuts to programs like Medicaid and education. This will also hurt implementing the Section 504 of the Rehabilitation Act, but there's also been a lot of civil rights departments who enforced the Section 504 that have been since shut down. So there's a lot of enforcement that's not happening, which is a concern. And how threats hurt people with disabilities. So it will make it harder to prove discrimination, but it will also cut off access to services and accommodations that are needed. With the Americans with Disabilities Act, it enforces equal access and reasonable accommodation in public life. So ADA is just general public accommodations. State agencies, local governments have to follow the Americans with Disabilities Act. It's much broader than what people think. A lot of times people think it's just a ramp or making an actual physical building accessible. It is so much more than that. It is about making sure that people with disabilities are included in every life area possible. And so there are responsibilities that stores must do, state and local government must follow. But it's not anything significant. And I will tell you that the Americans with Disabilities Act and Section 504 are both the floor. That means it is the bare minimum. So if people are fighting against these laws, then they're really fighting for the bare minimum for us to have rights and access. But the current threats to the ADA, obviously the executive orders demanding use of facilities and institutions over community supports, and then lack of Olmstead enforcement. And it attacks DEI, diversity, equity, inclusion. And that's very difficult to do our work without saying anything about diversity, equity, inclusion, because we are fighting for equity every day. And that is not, we're not fighting for a handout. We're just fighting for access so that we can have the opportunity to be able to be successful. We don't have that without these laws. And how will this all hurt? The Americans with Disabilities Act, there will be increased institutionalization if it gets if there's any more harm done to it. It will less the protection from police misuse, and it will less access to services in schools, work, and housing. So that is a whole lot. And we are going to kind of shift gears here, and we are going to talk about a little bit about the South Carolina win so far, and then we're going to open it up for questions and answers.
Yes. So Allie, again, I'm going to talk really briefly about a state bill called S2 that was signed into law in April. And we do consider this a huge disability win for this year, as this law brings changes to many disability focused departments and services. And I'll explain more about that on the next slide. So what is S2 and why does it matter? S2 creates a new state agency called the Department of Behavioral Health and Developmental Disabilities, DBHDD, a new acronym to learn. This new department will brings together the Office of Intellectual and Developmental Disabilities, which used to be Department of Disabilities and Special Needs, the Office of Mental Health, which used to be the Department of Mental Health, and the Office of Substance Abuse Services, which used to be Department of Alcohol and Other Drug Abuse Services. So some new titles to familiarize yourself with. I encourage you to explore that and familiarize yourself with those. These changes will make it easier for people to get the assistance that they need. Something to keep in mind, you might hear this term thrown around, but silo is a term that we often use in disability advocacy. It's something that South Carolina is pretty widely known for, siloed services. So even though many states have their own unique way that agencies can become siloed, South Carolina is pretty well known for that. And so what that means is that different departments or programs don't work well together, even when they serve the same people or the same communities. So in a state agency, a silo means programs are separated from each other, staff don't share information or resources very easily. Each agency has its own rules, systems, goals, and people working in one area might not know what's going on in another, even if they serve the same clients. And we see this all the time in this work. So for example, let's say Rachel is a disabled parent who gets Medicaid through Department of Health and Human Services, but she also needs child protection help from DSS, Department of Social Services. But she also has a disability that falls under DDSN, which is now the Office of Intellectual and Developmental Disabilities. But she also needs housing help from DMH, or now the Office of Mental Health. In the siloed system, each agency might make her go through their own eligibility requirements, their own paperwork, and that can really create barriers, time being one of them. Agencies may not share her records or coordinate plans with other agencies. So again, creating more barriers to services. She could be told different things by different departments. So all in all, this law is a step toward a solution for that. A big solution that people often look for is just combining agencies together, so things are more streamlined, communication is easier, and it is intended to prevent people from falling through the cracks in the system, and reducing that amount of time that paperwork can just increase. So this is a really big step toward progress in that way. Let's go on to the next slide, please. Okay, so what is new leadership under S2 and why is that important? A new role that has been created is the Director of Community Integration. And what that means is that this person will help expand access to home and community-based services, which we've talked a lot about. They'll help to lead efforts to ensure that people can live in the community and not institutions. They will help remove those barriers to independence, and they'll help oversee Olmstead compliance, put a little pin in that, and choose an ADA coordinator. They'll also help ensure that services are centered and focused on the person's needs and goals. So a quick little recap of Olmstead. As a reminder, the Olmstead Act is a rule from the Supreme Court that says people with disabilities have the right to live in the community, not be forced to live in nursing homes, institutions, or other separate segregated places. This act also requires all states to create something called an Olmstead Plan, which is like a roadmap showing exactly how the state will help people with disabilities live in the community and not in institutions. For 25 years after this rule was put in place, South Carolina still has not created this plan. Okay, so this law is the thing that's going to bring that together. So S2 requires these agencies to develop an Olmstead plan together, and this plan must focus on delivering services in the most inclusive, integrated, community-based setting, which is outlined in the ADA. And this means that an ADA coordinator, like I mentioned, will be chosen to help hold our state accountable to the ADA and enforce those rules. So for your information, so that you can remember this, the merging of these agencies, the bringing together of these groups are happening now. They're actually all at our state's health campus together in Casey, South Carolina, which is also where the Department of Public Health is. Staff from the governor's office are overseeing everything. They plan to get the agency stakeholders, or those members of that planning group, together around October to discuss the Olmstead Plan, and they're already looking at what other states have been doing to help with that planning effort. So while this is a win for our state, not to be a little bit negative, but it's good to remember what work there is left to do. It's important to recognize that sometimes South Carolina's leaders, including the Attorney General, present themselves as champions of the law and of disabled communities, but they often will contradict themselves by picking and choosing when to support and when to defy federal laws that have been around for years, depending greatly on their political agenda or their certain goals that they're after. These contradictions, like the attack on Section 504 and this win with S2, are exactly why advocacy is so, so important. And Kimberly is going to explain more about that in our next section. So let's go on to Kimberly.
Actually, this is Mary Alex. I'm going to temporarily jump in here because we're going to make this part really quick. I want everybody to take a second because we just talked about so much. I want you to shake it off. There's so much information that we're sharing with you. We are going to be sending you a recording of this. We are going to be sending you an accessible copy of our presentation. We are going to be sending you resources after the fact. So really quickly, I'm going to run through these slides, but you're going to get copies of them afterwards. It's the 35th anniversary of the ADA. We know that the work continues. Kimberly's going to talk more about why it is that the work continues and what we can do. But I'm just going to tell you guys about a couple of ways that we want to make good trouble with you. And I have a definition of what good trouble means. That means speaking up, rolling in, and refusing to be left out, connecting with your lawmakers. You can connect with ABLE South Carolina. We have details on slide 41 that tell you about the different ways that you can connect with us. I'm sure many of you are attending because you have already connected with us in some capacity, but you can share this information with friends and family. You can connect with your lawmakers. Super important. We're going to send out an email action alert tomorrow morning that is going to tell you exactly how to reach out to your lawmakers today. You can use a letter form that we've created to honor the ADA that we're going to be sending out. Also, you can connect with other advocates. We host an advocacy day for access and independence every single year in the spring, alongside over 50 other disability supporting organizations. That date is going to be April 16th of 2026. And then lastly, you can connect with trustworthy sources. We've written down a couple here from groups that we really like and appreciate. All of these groups have great websites, but they also send out email newsletters, action alerts, and they post to their social media accounts so that you can stay informed. So I'm going to kick it back to Kimberly to wrap us up, talk about why this conversation is a celebration of disability pride, and then to honor your time, we're going to jump into your questions.
You're muted, Kimberly.
Well, I guess that would help if I unmuted. So thank you, Mary Alex. So I wanted to just spend a little bit of time just talking about, the 35th anniversary, and this is a milestone anniversary of the Americans with Disabilities Act. We have a lot of work to do to protect our rights moving forward, but we have to remember that the ADA and Medicaid services and anything, what we really need is improvements to not only disability rights, but all of our services. So right now, what we're seeing on the federal level is and state level a little bit is that we're resisting the pushback to push us back further to where we have already been and we've already tried. So we all need to work together. A lot of times, legislators do say they do not hear from people with disabilities, so we need to get loud. We need to make sure that they are hearing our voices from people with disabilities and from family members, and letting them know every time you have an incident or every time you see the news and you're concerned about disability rights or your services, speak up. You can feel free to come to us, and we'll connect you with your legislators here in South Carolina or in Congress. But that's going to be really important to use your voice during these changes that we're not used to. The work will continue. If we want to go to the next slide really quick. The work is going to continue. People with disabilities are not going anywhere. We have been here we've been here always. So it's 1 in 3 people with a disability in South Carolina, and on the national level, it's 1 in 4. We are not going anywhere. We are a big community, and we deserve access right here, right now, and no exceptions. So we've got to continue to be strong through this and elevate our voices. So just like Mary Alex said, let's make some good trouble. But I thank you all for joining tonight. We are going to open it up for questions and answers right now. So Mary Alex, are you going to take that over?
Yes, I'm going to attempt to help moderate this. So as a reminder, we do have the Q&A feature here in Zoom, and several of y'all have already used that. Thank you so much. Or you can also raise your hand to ask to be unmuted to ask your question out loud. But we're going to go to those Q&A questions first. And then we also have on screen just a reminder of what we talked about today. But now's your chance. Ask your questions. Every question's a good question. So I'm going to start with the first one that was submitted, which says, how will the Department of Behavioral Health and Developmental Disabilities, previously DDSN, better collaborate with vocational rehabilitation to improve job opportunities?
So yeah, I'll take this one. And I recently met with the Commissioner Felicia Johnson of the South Carolina Vocational Rehabilitation, and they are really working on creating a memorandum of agreement together for the Department of Behavioral Health to really work with South Carolina Vocational Rehabilitation a lot more. I think that both agencies recognize the need. And so definitely look for those changes. And if you are running into any issues, please contact the Client Assistance Program over at Disability Rights South Carolina. We can put that number in the line. But change does take time. I have to remind myself that of every day. You've got to definitely, hopefully, we will see change very soon with these two departments. But I think they both want the same thing, and I do know that they are both working on it.
Okay, so our next question was if telehealth could be used more, especially in rural areas, to provide healthcare to people with disabilities.
So, Larry, you want to take this one? You came off from mute.
Yeah, sure. I can try to do that. So we definitely saw that during the pandemic in general, right? Where not just folks with disabilities, but everyone, it seemed, was accessing telehealth. And certainly that can be a good way to access healthcare in some circumstances, but that doesn't take the place of certain health situations that folks might find themselves in and what treatment support they might need. So it's not appropriate in every case, but certainly is an option that I'm sure will be looked at.
Awesome, thank you. We also had a question earlier in the chat asking about why it is that some states maybe didn't choose to expand Medicaid. It was a little more complex of a question than that. Kimberly, I know you had started responding to it. I'm going to punt that one over to you.
Yeah, so a lot of times states, especially the southern states, have had some concerns about the cost of it, and also that it is affiliated with the Affordable Cares Act, and so that has become very political. Now, we still have a lot to do, but we have been advocating to expand over and over, and our fear is that when Medicaid does start reducing and people are rolling off of Medicaid, South Carolina does not have a backup. So South Carolina does not have expansion. So that is going to be extremely concerning, and the estimated um, increase of uninsured South Carolinians is about 99,000 people by 2030. And so that's going to be scary because that's more people. And right now we're pretty high up with uninsured rate as it is because we're not an expansion state. And so pulling Medicaid down and reducing it to be a lot of people are going to fall off of eligibility. There is again just no backup, and so that is our current concern. We are going to continue advocating for Medicaid expansion because we do see that it is within the best interest of disabled citizens in our state, but also beyond. A lot of states that have expanded has been really positive for their citizens, including people with disabilities. And so we are learning from other states of how to bring this forth. So we are going to continue pushing this. But I think, the bottom line is a lot of southern states are just fearful of cost. But there has been study after study that show there's a return of investment, which means whatever the investment is going into a particular program, there's more money being created. So more people are able to work, more people are able to contribute to society. And so that is something that, we've got to continue to educate.
All right, the next question. This one was written directly to Larry, but I know anybody from our team could answer it. Can you explain what will happen to, they wrote Kelly Beckett, I'm not sure if that's the right term, for someone to get a personal aid for their disabled child?
And I can answer this. I will say that, any of these non-mandatory services in Medicaid areas, they could be at risk. So state agencies may try to phase out Katie Beckett or consolidate it, which could disrupt a lot of services. But I will tell you right now, we are waiting for the more details to come. There is something that will be issued that will give us more information, and it's called the Congressional Budget Office. So CBO will issue some information that tells us all about how much is going to be cut for particular programs, and also how things will impact individuals. So that has not come out yet, but I'm hoping that it will come out in the next quarter so that we can share that with you all at the next State of Disability in South Carolina.
Right. The next question was, what was the original intention of creating that Palmetto Pathways program?
Oh, pick me.
Go ahead, Allie.
Okay. Well, anyway, yeah, feel free to add anyone, but this was just in some of my notes that I was that I'm glad I'm able to share some of those. So, and originally this program was approved as what's called a demonstration project. So it's like essentially a program, a pilot program, if you will, to try something different from the usual Medicaid rules. It operates under a school of thought or framework that is not disability led or disability informed. And so there's a lot of advocacy opportunities around this. A lot of leaders sometimes get caught in the trap of thinking that work requirements are going to be effective and are going to help people eh, become or help people find more opportunities to work or volunteer. It's usually under this umbrella statement of we want to help people become more independent, while not really providing disability informed tools or an understanding of how that exactly can happen. And so we know that given past history, work requirements are not very effective. They've not actually resulted in gains in employment and people finding more jobs. So it doesn't really accomplish the goal that they initially set out to accomplish with work requirements. But the intention was very much the same with this program. It's to try to limit the get people off of benefits or get people off of Medicaid. And hoping to do that by work requirements. Anything else to add there, Kimberly?
I don't think so. And just like Ali said, in other states, this has proven not to work. I do know that we did provide public comment when this was issued. There was a time for public comment, and I do believe that South Carolina Department of Health and Human Services received quite a bit. And we did make sure that we provided comment around protecting disabled people, making sure that they are exempt from any work requirements, and also just making sure the definition of disability is very, very clear, that one should not have to be on Social Security to be exempt from any work requirements.
All right, and we've got just 3 questions left. Thank y'all for sticking it out with us. This next one, the original question says, if the other party is elected for president in 2028 and receives the majority of Senate and House, could some of these changes be reversed? But I'm going to flip this question around and say, can these changes be reversed? Because it shouldn't be up to partisan politics to make those kinds of decisions.
And I will answer that. I think, there's a lot of education to do with members of Congress. And anybody who is elected to the president seat, I think that there is some amount of control, but also that Congress makes a lot of the decisions. And so I think that we've got to definitely elevate our advocacy with members of Congress. Some of these executive orders coming out, I do think that there will be lawsuits. And I know that there has been many lawsuits already filed on some of the hits that the disability community has taken. And so we are waiting to see the outcomes of some of those. But a lot of this, I know that there is a lawsuit starting right now regarding the Medicaid cuts. So that is something that we will be seeing in the next couple of months. So, depending on whatever party you are affiliated with or politics, we always have to remember that disability is nonpartisan. There are people who have disabilities who are Republican, independent, Democrats. And so we've got to make sure that we're teaching our members of Congress that. but a lot of things that have ever been done can also be redone. So that is a short answer. Anybody could come in, and it could be either any party that could come in, and these changes, especially the executive orders, could definitely be reversed on day one.
And that is where we can use those good trouble skills, right, everybody? All right, we've got two last questions. One of them is a kind of a clarification question, wanting to know, is it Section 504 or something else that talks about discrimination against disability in the workplace?
So that's both Section 504 and the Rehabilitation Act. Oh, no, Section 504, but also the Americans with Disabilities Act. So um, in Section 504, there are protections within federal government to hire people with disabilities. And so people who work in the federal government has to follow Section 504 of their employment rules. And then anybody working outside of the government is the Americans with Disabilities Act. And I will, there was something that was called Schedule A, and I don't know if many disabled people know about that on the call, but there used to be a federal initiative to hire people with disabilities within federal government to make it more inclusive, but also, the reality is people with disabilities have a harder time getting a job. And a lot of times we're overqualified. We're more qualified than the people that are being hired, but we are getting discriminated. And so there used to be Schedule A, and I will tell you, Schedule A has been rolled back some, especially with all of the departures that have occurred within the federal government. And so that's another area that we will be advocating for. We're also advocating for a higher hiring incentive for people with disabilities in South Carolina. That's something that we want to see, where there could be tax credits given to any employers that hire individuals with disabilities so that we can get more people working. And so those are some of the things that we're working on. But ADA, so remember, Section 504 goes to the federal government. So anything that is federally funded, or if it's a federal agency, Section 504, and then ADA is everybody out. So state, local government, public entities, stores, restaurants, you name it.
Right, we've got two more questions queued up here. I think we might have time for three, so we'll see. The next question was, does the big beautiful bill, which we have been referring to as the budget reconciliation bill during this conversation, does it have implications for state departments of vocational rehabilitation?
So no, it does not. South Carolina, or vocational rehabilitation is actually funded under the Department of Education, under the Rehabilitation Service Administration, and we are unsure about any changes that will impact vocational rehabilitation right now, just because some of the changes within the Department of Education is not final. So we're hoping to hear more. Right now, in some proposed budgets, they are fully funded. I think they get a small increase. And so that is some news. And so we'll continue to make sure that you all are aware if there's any changes to these programs.
And our last question is, what will happen to Centers for Independent Living with the new budget bill that passed? And as a reminder, Able, South Carolina is a Center for Independent Living. I'm going to pass this over to Kimberly because there's a lot of different moving parts related to our status as a quasi-federal entity.
So, just for folks unfamiliar with Centers for Independent Living, we are disability-led organizations that are mandated to do 5 different core services, but we're also mandated to diversify our funding, which means getting grants and contracts with local government, state agencies, other nonprofits, businesses, to make our states better and make it be more accessible for people with disabilities, because we're behind the steering wheel. We Right now, the budget reconciliation bill that passed is not the budget for the disability programs. So that budget is actually being marked up and will go on the House floor and Senate in September. So we are unsure what's going to happen with Centers for Independent Living. Right now, under some proposed budgets, we do have an increase overall for Centers for Independent Living. But that is at the sake of taking on other programs that are uh, that are drafted to be eliminated. And so that's some of your protection and advocacy programs. So 60% of protection and advocacy programs are what we're calling on the chopping blocks. University Centers for Excellence in Developmental Disability is also on the chopping blocks, along with other programs, TBI programs, spinal cord injury programs, and amputee coalitions. So lots of different programs are definitely on the chopping block. So we feel that Centers for Independent Living, while we need an increase because we've not received an increase for decades, we also need these other programs to be fully funded. And so we are advocating for all programs, especially with all of these changes with Medicaid cuts. Everybody's going to need all of us. And so we need to be fully funded and ensure that we have the capacity to be able to serve and make improvements in our state.
Awesome. Well, guys, we are at 7:29. You stuck it out with us. Thank you. Before we go, a reminder, we are going to send you a recording of this. We're going to send you additional information and resources to follow up. But there is joy in disability pride, and we want to celebrate with you. If you find yourself in the Columbia area tomorrow evening, we would love for you to join us at Segra Park for Disability Pride Night with Columbia Fireflies. The game starts at 7:05 p.m., but gates open at 6. Able South Carolina team will be in section 111, section 111. And we are going to wear colors that represent the Disability Pride flag. So feel free to engage with us in that way. Information about this is also on our social media, but we'll follow up with you in an email. And there's also the link to be able to purchase tickets if you are interested. And as always, we would love for you to stay in touch with us. You can visit our website, able-sc.org. You can send us emails, give us a call, come see us. But right now, if you have the ability to do this, I would love for you to text the word ABLE SC, all one word, to 72572. If you're not already signed up for our email newsletters, that will get you signed up right away. And of course, you can follow us on social media at ABLE_SC on Facebook, Instagram, Twitter, also known as X, LinkedIn, and we do have a YouTube channel as well. Thank you guys so much. We covered a lot with you all, and we look forward to maybe covering a little less in October, but also definitely getting just as in depth as before. But thank you again so much for being here, and we're going to call it a night. Thank y'all.